Well, good afternoon, good morning. Good morning. It's particularly to Nikki here on the West Coast, who's joining us very early, and we are very grateful, Nikki. It's she's just informed me it's 3:45 in the morning. So thank you very much for getting up. And Peter, thank you for joining us in the sunny coast of Ireland. I think you're down near Kerry, which is fabulous. I just want to frame this for people who are joining us, because we've had really great sessions this morning, and I really think this is a fundamental discussion point here today is around leadership and kindness, and the importance of kindness and having boundaries and values as well to drive that forward. And I'm really pleased that I have Peter and Nikki here today to give us a real insight into how to deliver that change from a values perspective. So let me just start with, firstly, Peter, CEO, World Financial Planning, and also I hope he doesn't mind me saying, is an all-around great guy, because I've known Peter a number of years. He is a leading light in terms of influence and kindness around ESG. He writes I've read a number of his articles for the Financial Times, and Peter, it's like a true honor to have you with us. And then, of course, Nikki, who I've only really met recently, who has become one of our global ambassadors and has been doing pioneering work around financial investments and grant making in the US. And looking forward to how we can work together to bring that to a scalable level. So let me just hand over to you, Nikki, because I know you're having the coffee there and keeping yourself awake. And to ensure that you don't fall asleep, I put the spotlight on yourself and say, please, just a short introduction, and then we'll hand over to Peter.
Sure. Well, thank you, Gareth. It's a pleasure to be here, truly. And as you mentioned, I am coming to you at 3:45 a.m. Pacific time. I'm currently in San Diego, California. And for more than 30 years, I've worked at the intersection of healthcare, philanthropy, education, and workforce development. Today, I manage philanthropic investments that strengthen the healthcare workforce and support healthier communities through partnerships with educational institutions, nonprofit organizations, and community leaders. In my current role, I'm fortunate to work for Kaiser Permanente, which is a healthcare organization that's made significant commitments to social health through dedicated strategies focused on economic opportunity, food security, housing stability, impact investing, and community health. And I'd say I'm committed to health and community apart from my work too. I am a spin class instructor and am active in my local Toastmasters chapter. And both constantly remind me that health is definitely built through connection, belonging, confidence, and purpose. So thank you.
Wow. Fantastic, Nikki. Well, Peter, top that.
On top of that, it's 11:49 here in County Kerry, not 3:45. I'm not sure I'd be that bright and chirpy if it was me, but I'm the chief executive of Worldwide Financial Planning. But separately to that, we coach and mentor lots of different companies on strategy and purpose, which is where the kindness piece comes in. I often find it fascinating when we think about kindness. There's that movie by, it's called The Invention of Lying, which is quite extraordinary, because you're thinking, well, where does lying come from? Because surely everything should be truthful. And you think about life, actually, just everything should be kindness, but it's surprising we have a word for it. It should just be normal vocabulary. But I've spoken twice at World Kindness Day on this subject, and been involved in a number of different things around kindness and ESG, and it was very vocal on it until particularly Twitter, where I would have been very vocal on environmental, social governance, kindness, etc. And was voted very highly in terms of my influence on it. But the minute someone else took over that, I couldn't align myself to being on Twitter any longer. So that's me, Gareth. Thanks,
Peter. But look, I'd really appreciate you taking a deep dive into sort of how would you define kindness?
Me? Okay. Well, I mean, kindness, I often hear people talking about random acts of kindness, and I think, what do you mean by that? Because I disagree with that. I define kindness as the intentional act of noticing another person's need and responding in a way that protects their dignity, reduces any unnecessary suffering, or, because it's not about protective just, or it helps them flourish as well. And that can be a really simple thing. I think of the things that have impacted me, which I might talk about later. And they, born in 1968 in Northern Ireland, and we all know what happened there. You have to somehow navigate your way through all that, and different bits of kindness help you do that. But sometimes it's just a simple touch on the soldier, Northern Ireland, a touch on the shoulder, a reassuring smile from somebody, like a hug, obviously a donation, a how are you, and you're passing someone on the street, or what's the crack, as we would say back in Ireland, or just simply noticing people. These are very small but brilliant acts of kindness. But fundamentally, I think what is in behind kindness is something that I consider to be a very powerful drug, which is attention. And attention for me is defined as the need to give and receive it. And it's a very, very powerful drug and a core human emotional need, one of the 9. Now in health setting, caregivers need for receipt of attention is often quite low, but with the need to give it rated way, way higher in terms of their desires. But they still need kindness and a well done, and whatever that may look like, a little pat on the back to say that. So, and fundamentally for me, kindness is how the other person feels after you've done something, or I would say for me, more importantly, how I feel afterwards. Because if I'm the giver, how do I feel afterwards? Because that's what'll make me perform at my best and help me hold my head up high and get the very best out of my life. So for the small acts, might be a doctor sitting down rather than standing over a patient. It might be a manager saying, tell me what's really going on in your life. A nurse remembering a patient's name. A receptionist not making someone feel stupid because they filled the form in wrongly. So multiple areas of kindness there, Gareth.
Yeah, thanks, Peter. And Nikki, I mean, kindness is such an important part of health service delivery. And what I've noticed, over the last 20 years, 25 years, is a slow erosion of that kindness and values that Peter was talking about there, and how, initially you go in the morning, and I used to work, start at 7 in the morning packing vaccines to go out and help children. And then you would work all the way till 9 o'clock, 10 o'clock at night, not a bother. And it was just part and parcel of what you did. But that has been eroded. Can you give us your insight into what kindness means within the health sector?
Mm-hmm. Yes, and I'll share not only from the health sector, but also philanthropy. And similarly, I believe that kindness is more than just being nice. It's recognizing humanity, dignity, potential in another person. And as Peter said, really figuring out how to respond in ways that help them flourish. And it's also recognizing that the clinician or the grant maker or the organization does not have all the answers. So it's looking to the patient, the nurse, the physician, the community member, the policymaker, the nonprofit organization, in my instance, I'm working with. And each group or individual brings perspective that is needed. And so, throughout my career, I'm reminded that kindness begins with listening. And listening shares that you matter, and your experience matters, and your ideas matter. And when people feel heard, they contribute, relationships grow, communities become stronger and healthier. So for me, kindness is more than a personal virtue per se. It's how we design healthier systems, and it's how we can help create health.
Yeah, it's fascinating. And I know, Peter, you've had, from your perspective, like, why is kindness so important to healthcare? I mean, I know you have some personal stories as well.
Yeah, I'll maybe cover some of those personal stories later. But when you go into an airport and everything runs smoothly, when you go into, or the reverse, if you go into a hospital and everything seems to run smoothly, that comes from some reason. And I like Simon Sinek's book, which is Start With Why. And he says, people don't buy what you do, they buy why you do it. And so if we go to the top of an organization, why do you do that? And so what's the why of the organization? Is it profit? Is it making stuff? Is it getting paid? Is it promotion, paying your mortgage? Well, no one's really going to get inspired by that in the long term. Once they go past enough of their human given needs, they're not going to get inspired by that. So profit making stuff and all the rest of that's just the what and the how. So the more inspiring why, and the more it meets people's emotional needs, the more likely you're going to get contentment. So kindness and its impact is a why, and that why should run through every organization's veins, because that's where the actions come from. And healthcare is where people meet life at its most vulnerable. So if there's a place for kindness, it's in healthcare. So, people arrive frightened, they're tired, they're confused, they might be embarrassed, they're in pain, they're grieving, they're ashamed, and they're trying to be brave. So in that moment, the technical skills matter hugely, the technical skills of the healthcare, but the human experience determines whether that or not they feel safe and valued. So like a blood test can be clinically correct and still feel cold. A diagnosis can be accurate and still be delivered in a way that breaks somebody. A discharge can be efficient and still leave a family terrified. So kindness isn't an extra, it's that it changes the experience of the care. It says to the patient, you're not a task, you're a person. And it says to you, the staff, you're not a machine, you're a valuable, worthwhile person too, and a brilliant one for that matter. So that matters because healthcare workers often come into the profession with huge amount of kindness, wanting to change the world, so excited. Like, I know you, Gareth, for a long time. I mean, my God, you have so much energy in trying to change the world for the better. But when healthcare workers come into the profession with this kindness, and remember the tension I said earlier on, where the need to give it and the need to receive it, well, their desire to give it is way, 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 way bigger than the need to receive it. So, but they come in with kindness, but the systems can slowly or quickly train them to suppress that. Not because they stop caring, but because they're overloaded, under-recovered, and constantly asked to do more with less. So the question is, have we built, coming back to what you said a few seconds ago, Nikki, have we built a system or designed a system where kindness can survive? And the important thing for this room is kindness isn't only a bedside behavior, it's a culture, and culture is designed from the top by leadership.
Absolutely. And I'm going to put this to Nikki, because I mean, I know, why did I join the fundamental reason, why do I do what I do? Why did I join the health service? Why, it's because I wanted to help people. That was it. Simple. I just wanted to help people, so from your perspective, Nikki, why is it so important for healthcare?
So kindness and health are broad topics, and health and healthcare are not the same. Healthcare treats illness, but health is created long before someone enters a hospital or a clinic, and it is shaped by housing, education, purpose, employment, social connection, belonging. So clinical excellence definitely saves lives, but when we think about kindness and human connection, that really changes lives. So we need both clinical excellence and kindness and human connection to impact health. And as someone who invests in healthcare education, I spend a lot of time thinking about the future workforce. And in doing so, we teach clinical judgment and evidence-based practice and technology and quality improvement. And all of that is essential. But we also need to continue to teach and promote and role model caring with the same intentionality, and figure out how we can help our healthcare providers to build trust and dignity and help people feel seen. So these aren't soft skills. In my opinion, kindness is not a soft skill. It's a foundational skill. Yeah. And every clinical interaction is a human interaction. So if we're serious about improving health, we need to prepare the healthcare professionals to care not only for diseases, but for people.
Yeah, and that brings me nicely on to the next sort of question there, Peter, just around like, why are we so moved by kind acts that we see, and then Mickey's just been touching on it there within the health sector.
I suppose I use some TV programs or little different things that you see and you think, well, why are we moved by that? So if I watch for all the readership, DIY SOS is a program where all these tradespeople come to someone's house and they change it around whenever they're not there, and then at the end the people come back to the house and everything is changed, and all these guys are watching their emotion, and you're watching their emotion because they've changed their house, and you just see that. And I cry through every single one of them. I build up all my crying for everyone. It's just fantastic. But and so why is that? Why has it moved so much? There's a little clip on the internet if you want to look it up. The viewers want to look it up, but it's a beautiful clip of a chef on a stall, and he's giving food to a homeless person. And there's many kindness clips out there on social media, and they really move people with huge engagement levels, significantly higher than people posting stuff about their food clips, etc. But I think kindness clips are the only reason for social media, for the record. But this clip shows the moment someone who may feel invisible is treated as if he matters. And look it up, please look it up afterwards, and I promise you'll be very moved by it. But the homeless man comes with a small amount of money. It's all he has, and he just moves forward to the person, and he's trying to preserve his own dignity. He's saying, I want to pay, I want to be part of the normal exchange here. And the chef doesn't take the money initially because I think he's just preparing the food. And the homeless person is like this. He's just so excited because he's going to get some food, and he's moving around like this, and he's very visibly moved, very clearly very touched by the kindness, wriggling with humility, excitement of receiving food, and all with this big, humble, reserved, beautiful smile. But the most important thing, he's seen. And whilst the chef doesn't take the money, he also doesn't make him feel pathetic. He prepares the food properly, wraps it nicely, gives it warmth, and then walks over to the guy, hands him his food, doesn't take his money, says, no, I don't want the money, and gives him a big hug. And that hug changes everything. It's because it's no longer a transaction, it's recognition. And what moves me and what moves most people is that it's not that just that a hungry man receives food. It is for that moment someone refused to let that world treat him as less than human, and we all of course recognize that, and this is why people cry at clips like that. But I suppose to summarize that, all of that and above, and all of those clips, I think fundamentally we're moved by kindness because it reminds us of the world that we still hope we belong to. So we're moved by kindness because it reminds us of the world we still hope we belong to. And there's another reason. So when we see kindness, we get evidence that goodness is still possible in a world full of noise, anger, fake perfection, edited lives, outrage, cynicism, and people just selling themselves constantly. A simple kind act cuts right through everything, and it feels real. So, it touches that ancient part of us which says this is how humans are meant to be with each other.
I totally agree. And then I just want to move just slightly on to say just to Nikki, and I'll come to you as well, Peter, on this point as well. But what does kindness have to do with leadership, Nikki? Because you're in the space of HR. You've been around us for many, many years. I mean, I know one thing that's always stuck with me. My mentor, Professor John Bonner, said to me, "Kill them with kindness." I remember that. I remember him saying that to me previously when I just joined, and we were going some really difficult situations in the Department of Health at the time. And he just said to me, Gareth, kill them with kindness. And it's always stuck with me.
Well, to the point of kindness and connection, I think leadership is less about having all the answers and much more about creating conditions where the best answers can emerge. So for me, health is a team sport, and innovation happens when clinicians and educators, community organizations, policymakers, entrepreneurs, patients, and funders can contribute what only they can bring to the table. So the leader's job isn't to be the smartest person in the room. It's to make sure every valuable voice is heard. And that requires kindness and humility, curiosity, and requires sharing power instead of holding on to it. So whether I'm coordinating philanthropic partnerships or facilitating a Toastmasters meeting or teaching a spin class, my role is never to have all the answers. It's really to help other people discover their strengths and bring it forward. And I found that people do their best when they feel respected and trusted and like they belong. And that is the culture compassionate leaders can create.
That's yeah, it's a brilliant insight, Peter. The leadership side from, I mean, you know, be great to get your insights as well on this.
Kindness. It's easy to be kind up, but kindness down because you're busy, etc. And I respect the amount of leaders who are fully up against it, and sometimes they forget because their job is to fix things, and all their job is to notice things that are wrong. Really, I get that. And if you think of the 1 minute manager, we focus on catching people doing things right. So kindness at the top either travels down as safety, or its absence travels down as fear. And fear is very expensive. Fear makes people hide mistakes, makes people protect themselves instead of the patient, makes staff stop speaking up. It makes people leave. It makes good people emotionally withdraw while still physically turning up, which is burnout. And that's the performance lag that people miss. So some people might be in the building, but they might be still being paid, might be still doing tasks, but their courage, their creativity, their warmth, their discretionary effort, they've all gone. And that's the hidden cost of an unkind culture. So people don't give their best selves to environments where they don't feel safe to be a human.
And that's perfectly leads me on to the next question, which is around the role of vulnerability play in this.
You asking me or Nikki?
Peter, yeah, please. And then we'll go back to Nikki.
Yeah, okay. Well, vulnerability is where the truth lives. You know, a patient has to be vulnerable to say, I'm frightened. A nurse has to be vulnerable to say, I'm not coping, I need some help. A junior colleague has to be vulnerable to say, I think something's wrong here. And a leader has to be vulnerable to say, I got that wrong. So, but people only show vulnerability where they trust the environment. If you think of people that you show your vulnerability to, you really got to trust them. And it's a real display of trust in the person who's in front of you. So that's the key. If the environment is not kind, people don't stop having needs, they just hide them. That's dangerous because hidden confusion becomes poor decisions, hidden stress becomes burnout, hidden mistakes become harm, hidden debt becomes crisis, hidden fear becomes silence, hidden staff dissatisfaction becomes turnover, and that's where kindness becomes very practical. So a kind culture is not one where everyone is soft. It's where reality can be spoken before it becomes damaging later on. And in healthcare, that is critical. So a psychologically safe team is not one where standards are lower. It's one where people can speak early enough to protect the standard and then move it forward.
Completely agree. Nikki, you know, you've probably come across this many times, like myself, in terms of quality of care, particularly around, I was involved with contaminated blood products, HIV and hepatitis C. It was all about being open and transparent and allowing people to be vulnerable.
Definitely. And, you know, I am in strong agreement that vulnerability is where trust begins. And whether it's patients or people in the community you're working with, people don't expect perfection. They really are looking for authenticity and connection. And the strongest leaders I've worked with aren't the ones who always have the answers. They're the ones who are willing to open up and say, I don't know. What do you think? Help me understand. Those types of words and phrases can invite collaboration and create psychological safety. And for me, psychological safety is really the space where innovation and strong thinking can begin.
Yeah, totally agree. Look, we've got 5 minutes left and I'm conscious of the time, and we've got a few questions I want to get through. So we'll try and do like quick fire rounds here, but I want to make the point as well. I think I've experienced this recently where I had incidents where I was allowed to be vulnerable in certain situations because I trusted the environment. I think it's really, really powerful to be able to do that. I think it's so important to make that point. So, Nikki, just briefly go back to yourself to keep you. Kindness, can we really scale it across systems, policy, and sustainability? Do you believe it can be done?
I don't think any healthcare system can truly scale without it. Mm-hmm. Systems are really networks of relationships, and relationships are built on trust. So for me, I believe there are two forms of capital we're working with. There's financial capital and there's relational capital. And financial capital builds programs, but relational capital builds movements. Relational capital's trust, listening, transparency, shared purpose, long-term partnership. So I feel like we need the both in order to scale. And building the relationships allow opportunities to grow and scale.
Yeah, absolutely. And Peter, you've often heard me say trust is the oil of the future, but I'm very conscious. I want to make sure that you can cover some of the stories of kindness in action, because I know it's a topic for yourself. So perhaps you could share that with like some of the insights that you have, please.
Given time. So I do. So I'm not quite sure if on the screen, can you actually see my mum over there in the corner?
Let me just see. I might be able to bring you into focus. Let me just, if I can. Yeah, let me do that. Hold on, Peter.
That's fine. It's just on mine. I can see her.
Yeah,
I can see it. You know. But
yeah, but we have you in focus now. Yeah.
Okay, good. So next week I go to Tuscany to see Andrea Bocelli on the anniversary of my mum's passing. She was only 59 years old, so I was 35. So I was very confused about that. But every year I go to Tuscany because on a trip to Tuscany just before she passed, I was taking her to see Andrea Bocelli, and but she didn't leave the villa. She wasn't well, so when she returned home and went to the hospital, and then she was diagnosed with cancer, told she had months to live rather than years, and she was dead within 9 days. And I was only 35. I didn't know how to deal with that at all. So whilst when I was in the hospital, I was met by pure and good standards. So and then I asked about one quite rude nurse, you know, and she was so short, and I said, what's the crack with that lady? Kindly. And then someone said to me, her husband is dying of cancer. Isn't it funny how your mind changes immediately with passion, with compassion? So, and then I went downstairs to the canteen. This is just a nice story of how kindness works right around the system. So when I was down in the canteen, I was very bewildered, and you know, I'm a very passionate guy, but I'm 35. This person who gave birth to me is actually not going to be here. I can't get my head around that. So, and I happened to sit next on a table to some Macmillan nurses, and one of them asked me what was up. So I told her, and her response was she was kind of sideways on, but she turned her seat right round towards me, very deliberately, with complete attention. And she gave me some great tools to help me in only 10 to 15 minutes. But some great tools to help me, and then she turned my spaghettified head into some sort of normality. And then from there, we raised tens of thousands of pounds doing marathons for Macmillan Cancer Support. And her kindness was passed on in multiples because she gave me some tools and she gave me attention. So I was forever grateful for her. But I then went upstairs, and as you know, I write financial columns for many newspapers, and I used to write my column, and then I faxed it to my secretary who typed it. So when I was writing the column, it was on the state of the economy. It was in 2003. Markets were collapsing everywhere, and I had to write it. And for some reason, I thought it's appropriate for me to dedicate this column to my mother, hence the mindset. But I just come from downstairs. I've got my mother in front of me. I've described the economy. I've described everything. And then at the very end of the column, I actually typed this. I said, to put all your financial thoughts and worries about the economy into perspective, consider this, that in 50 years from now, the size of your car, house, bank account, or problem won't matter, but the world will be different if we're important in the life of a child. Thanks, Mum. And that's gratitude to kindness. And my father kept that in his drawer, unbeknown to me, for many years, and I found it after he passed. So just an example of a little 10 minutes of kindness going ding, 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 all the way right through.
That's a brilliant story, Peter, and thanks for sharing it. You know, and Nikki, just I want to come to you because we're on the final thoughts here, really, because we've already reached the 30 minutes. Believe it or not, it's gone so fast. But this has been a powerful session, something we will pick up again. Nikki, final words from yourself around kindness within the health sector, but also broader society, because we've really touched on it. Peter's given a great story there, but if you want to share something yourself, please, final words.
Sure. I'd say in closing, everyone has something valuable to contribute. So let's continue investing in clinical excellence. I'm all for that. But let's invest just as intentionally in human connection. So teaching technical expertise alongside compassion. I like the idea of measuring financial capital, but also relational capital, because it's trust that will determine what lasts. And if we can lead with kindness, we can build communities and countries where people have the opportunity to do more than survive, but to thrive.
Thanks a million. Look, I just want to say thank you to Peter and to Nikki. Both been of just amazing insights here into leadership, kindness, so important, that, and the trust element as well. But I think when you get into this level of trust and kindness, you realize that you can be vulnerable with your colleagues, and they should be able to accept that vulnerability as well and not be judgmental. And they should have that understanding that this is reality, this is life, and it's difficult. It's not easy for people. So look, Peter, Nikki, thanks very much for the discussion. And we're going to take a short break. We're back on in just under 15 minutes. We have more insights from global colleagues and youth engagement. So join us then. But for myself, Peter and Nikki, thanks very much for joining us for the Fireside Chat, and we'll talk very soon. Thank you, everyone.
Yeah, thanks for having me.